Hello, everybody. Welcome to the Neurology of Cervical Instability with emphasis on the vagus nerve. My name's Dr. Ross Hauser. I'm a specialist in physical medicine and rehabilitation. I'm coming to you live at our media studio at Caring Medical, Florida, at the Hauser Neck Center. As some of you know, I've already done 4 hours of vagus nerve webinars. So anyone who hasn't seen the other two webinars that I did on the vagus nerve, I'd go to caringmedical.com and you can watch that. Some of this stuff today is going to be review, but I guarantee you 2/3 of what we're going to cover today is totally new. As you know that whenever I do a webinar, I like to give state-of-the-art information and show you what's the latest in vagus nerve care, vagus nerve regeneration, and hopefully this is going to provide you the answers that you seek for the healthcare complaints, the symptoms you have, the medical diseases that you've been diagnosed with. And I can assure you that if you follow the neurology of almost any human disease, whether it's anxiety, migraine headaches, neck pain, arrhythmia, gastroparesis, where the stomach doesn't work, mental fog, right? We're going to do a big section today on mental fog and brain fog. The neurology will lead you to the vagus nerve. And the question always is what's causing the vagus nerve not to function properly? And honestly, there's two main causes. The one main cause is stress, and the second main cause is cervical instability. And if you resolve the things that are causing you stress, or you don't allow them to give you stress, and you correct the cervical instability, the vagus nerve function starts to get back to normal. Okay, how do I? Okay.
It should just work now.
Okay.
There you go.
Okay, so we know in 2020, alcohol consumption has been at an all-time high, as well as coffee consumption. And I don't know about your house, but we got an awful lot of toilet paper. So what we're going to do with the toilet paper, I don't know. But I can assure you that all the stress that everybody's been feeling because of what's going on in our country and around the globe, it's absolutely hurt our vagus nerves and vagus nerve function. If you actually are concerned about how your body handles stress, for instance, if during this current crisis, the corona crisis, if you had a lot of fear and your healthcare problems got worse, it's because your vagal tone isn't as good as it should be. When your vagal tone is high, your health is high. When your vagal tone is low, your health is low. And the way that you monitor your vagus tone is to get a heart rate variability monitor. So we'll talk about this later, and we'll see what my heart rate variability is. When the heart rate variability is high, the person has vibrant health. When the heart rate variability is low, the person's health is poor, and they have an increased chance actually of dying. In experiments from centuries ago, they found the predecessors of modern neurology, or you guys have heard of the Valsalva maneuver, well, Dr. Valsalva and Dr. Morgagni, they found out that if you injure the vagus nerve, you actually get lesions in the lung. And if you cut both vagus nerves, the animals die. If you injure the vagus nerves and you give a little bit of a pneumonia bacteria, just a little bit of the pneumonia bacteria, the animals die, whereas animals with intact vagus nerves, they live. So in other words, for lung infections, right, coronaviruses, lung infections, if you have a high vagal tone, you could get exposed to a lot of coronavirus and nothing's going to happen to you. If you have a low vagal tone, you could have a little bit of coronavirus and it could ultimately lead to death. So for all of us who want to stay healthy in these times, what we have to do is increase our vagal tone. And that's what this talk's going to be about. We're going to talk about things that you can do to increase your vagal tone. But some of the new stuff that are going to be in this webinar is, what about vagus tone in kids? So we are going to talk about why kids have disorders that nobody knows the cause of, why your child might have imbalance, their stomachs don't work, they have migraine headaches, they have neck pain, they have whole body sensitivity. So if your child has a condition and nobody knows the cause of it, it's probably they have cervical vagopathy, they have vagus nerve degeneration from their neck. We're going to talk about the obstructed brain toilet. Like, in other words, because of cervical instability, and by cervical instability, I mean that the vertebrae, the cervical vertebrae, are moving too much because of ligament injury, and that ligament injury is then compressing or stretching the vagus nerve, and then the vagus nerves, which are the most important nerves in the body, don't function well. Then the digestive tract doesn't function well, the heart doesn't function well, the lungs starts having trouble, and believe it or not, even the flow in and out of the brain is not normal, and you can get altered brain function. We're also going to cover Botox injections or botulinum toxin injections and why that may not be a good idea, especially if you have cervical instability. That's me. Many of the upper cervical injections we do under X-ray or ultrasound guidance. Anybody who wants to know if the things that I say are scientifically sound, I would encourage you to go to caringmedical.com and look at a lot of the articles that I've written and my team here has written. I would like to thank my media team who worked tirelessly, especially Nicole, over the last week. I'm here with Izzy. I thank you to Ben and Travis, to Barry, and the whole Caring Medical team, because to put all these slides together, we're going to go through, believe it or not, over 100 slides, and those slides take a lot of time to make. At the Hauser Neck Center here in Fort Myers, Florida, we see some of the hardest cases in the country. This is from a Skype visit I did yesterday. The person has brain fog, breathing difficulty, trouble concentrating, facial pain, headaches, irregular heart rate, fatigue, blurriness of vision, lightheadedness, postural low blood pressure, ringing in the ears, flashes of light and vision, vomiting, sensitivity to sound. Their stomach isn't working. And when my staff took the history, the patient was so sick that the history had to be done by the family members. So just know we take on the most difficult cases. If you want to talk to me or my team, I'm available for Skype visits. So just know that we now do telemedicine. So, and the reason that I do this is some of the cases are so severe, the vagus nerve issues are so severe that it's actually life-threatening. About 2 months ago, I did basically a television interview, if you will, with a family, and the family we saw them for the first time today, and the person has lost 35 pounds since they had a car accident since February. So think of that. It's only May, so within 3 months, the mother of this family has lost 35 pounds, and she's in agony, and if something isn't done, basically the person's going to die. So when we talk about the vagus nerve, you need your vagus nerves to live, and the vagus nerves are involved in every function of the human body. So, and because looseness of a joint is a progressive disorder, cervical instability is a progressive disorder, meaning the damage caused by cervical instability, including on the vagus nerve, is progressive. And if the vagus nerve stops functioning, so does life. Up here in the upper right-hand corner is Dr. Hackett. Dr. Hackett was the person who coined the term prolotherapy. his books, if you really are interested in prolotherapy, I'd say get his book called Ligament and Tendon Relaxation Treatment by Prolotherapy. Prolotherapy is defined in Webster's New International Dictionary as the rehabilitation of an incompetent structure such as a ligament or tendon by the induced proliferation of cells. There's one treatment in the world that can tighten a chronically stretched out ligament, and that is prolotherapy. So if you have a condition that's caused because the ligament is incompetent, then the only treatment that has the potential to be curative for you is going to be prolotherapy. So if you have your head sitting on vertebrae that are loose, like in other words, there's ligament injuries in the upper cervical region, think of all the different conditions that that's going to cause, right? So in other words, the top vertebrae is loose, so that obviously could cause the vertebral artery blood flow to go low, and also the nerve centers that are around C1, which we'll talk about, which include the vagus nerve and the brainstem. Those nerve centers could start to get damaged, and the nerve cells actually die. Dr. Hackett, this is at a physical medicine rehab course in the 1960s. He taught Dr. Hemwall prolotherapy. Dr. Hemwall then hired Dr. Hauser in 1993, and then Dr. Hauser was the doctor who took over Dr. Hemwall's practice. There's a lot of information on our websites on prolotherapy. So this talk is about the vagus nerve, not about prolotherapy. But for those who are hearing it for the first time, we practice H3. I practice H3 prolotherapy, which the three H's stand for Hackett, Hemwall, Hauser. Prolotherapy is an injection technique that causes the ligaments to strengthen and tighten, and this process occurs over several months. Prolotherapy is typically done for cervical instability about every month, and the normal person needs 4 to 6 treatments. Prolotherapy can be done anywhere in the body, any place where there's a ligament. Ligaments are the weak link in the musculoskeletal system, meaning that they're the first structures that break down that give support of the body. So if you have knee pain, and you have chronic knee pain, it's probably because you have ligament injury in the knee. If you have low back pain and you have tightness in your low back all the time, it's probably because you got ligament injury in your lower back. And remember, I said that the only treatment that can tighten a chronically stretched out ligament is prolotherapy. And there's lots of different proliferants we use in prolotherapy. The most common one is the normal sugar in the body, which is dextrose. But there's lots of different proliferants, including bone marrow, fat, PRP, and I'd encourage you to go to caringmedical.com for further information on prolotherapy. Now we're going to see one of my associates, Danielle, in the Chicagoland office treat a person C1 area under ultrasound guidance.
This is for a neck C1, C2 injection with ultrasound. We're using this small curvilinear probe. So I'm just going to place it here, and what you'll see on the image, this is the occiput. Here's C1, 2, 3, and then down the spine. So first thing I'll do is find just where C1 is, and I throw on Doppler just to look for where most of the vertebral artery, so there it is right there, and other blood vessels. So I'll change my view so it's out of my view. And then I throw on this midline. Okay.
Do you want a 1 or half?
I'll take a half. And so that midline will actually guide where my needle should go. So we could look here. So looking here, there's the midline on the probe, which lines up with that yellow line. So I'm going to start. We're going to start. Touch. There we go. And you can see on the ultrasound screen that jiggling means my needle's right on C1. So we'll aspirate, make sure no blood, and then we'll inject. And then I'm going to go a little bit farther down. So here's C1, here's C2. Again, I'm going to throw on my Doppler. Make sure there's no blood vessels in my view. There's that one, but that one's way far ahead. And then same thing, what I'm going to do is I'm going to put my needle down here to C2, and then I'm going to walk it off to get to that C1, C2 joint. So I'm going to go here, feel a touch. Aspirate, make sure there's no blood. And then you can see on the screen how I'm kind of walking in between C1 and C2. Again, no blood, and I'm going to inject there. Okay.
Today we're going to talk about one specific case, and you're going to see that Stefanie, and that's actually her name, she gave us permission to use her name. The vagus nerve can be involved in every single symptom that you see there: vertigo, difficulty swallowing. She has Ehlers-Danlos syndrome. She gets drop attacks. Her main symptom is her stomach doesn't work. She actually has a port in her, which is a central line, because prior to coming to Caring Medical, she needed IV fluids just to maintain her blood pressure. She has mast cell activation syndrome, which is where her immune system kind of goes crazy because it's the vagus nerve that controls inflammation. She doesn't have good control of her bowels because, again, you need the vagus nerve for that to work. Before we treated her, she had speech difficulties, memory loss, right? Almost everybody with vagus nerve issues, with upper cervical instability, they end up having brain fog or they can't concentrate. So let's hear from Stefanie herself.
How do I explain it? There would be episodic periods of time ranging from 3 or 4 months where I wasn't able to really eat right, and my right side was just constantly in pain. And every doctor I went to would just kind of blow it off, say that I'm attention seeking, which honestly, if anybody hears that, it's just going to break their heart, because internally you know something's wrong, but for some reason I can't show you on the inside what's actually going on. They just trust the results, trust the blood tests, and send you on your way. So I got my official diagnoses 2 years ago, in between there, from Dr. Kelly. We went through it, and she's like, okay, so you got mast cell activation disorder, and then we have POTS, and then we have gastroparesis, and then we Ehlers-Danlos syndrome, type 3.
When you came here, what would you say if we could help you with 3 things? What are the top 3 things?
So I probably start with the gastroparesis because this is the main reason why I get hospitalized 99% of the time. I'm in there for a week, and they're having to pump medications in me in order to get my nutrients level back up.
What does the gastroparesis cause for you that you need to then get hospitalized?
So basically, and I had like a gastric emptying scan, 2 of them.
Yeah.
If you look at the numbers, it's like really high in the first 2 hours, and your average is supposed to be like 10% by the 4 hours. Mine was at 35.
Okay.
So basically it takes me a full 8 hours to digest a full meal.
Okay.
And that starts pain. It's just really uncomfortable
You get nauseated.
often.
And it's
Even
hard
if
to
I'm-
maintain your weight, right? So that's like the dangerous thing, right?
Yeah, I'll drop 10 pounds in a week.
Right.
Right now, we try to keep my weight up really high, so when those drops happen, I don't get so low.
Why did they have to put a port in you, like a central port? Why did they have to do that?
So the first diagnosis I had was POTS, and they were considering different methods, but because the fact that I would be at normal blood pressure, supine, but then when I'd stand up, I'd be at low. They couldn't do beta blockers, things like that. So I actually looked it up, and I saw that some articles said that saline infusion can actually, with the salt and water, help increase your blood volume and help develop more blood.
Okay, so it kind of keeps your blood pressure up.
Yes.
And then how do you feel like your thinking is, or your memory? Has your condition affected that?
Just this whole thing.
Yeah.
Honestly, like it's affected me greatly. I've had to give a lot of passions in my life and just be like, I can only handle one thing, and that's my health. And my
Like
mom,
it's overcome your life. Like you actually
Yeah.
can't do anything else except just try to stay alive, basically.
pretty much, my mom has to drive me everywhere.
Okay. And how old
It's-
are you now?
I'm 27,
Okay.
which sucks because I wanted to be a teacher, counselor.
And you were almost close to graduating college, right?
I was 2 semesters away.
Okay.
The staff really loved me. They wanted me to work at their school, so it was a great big promise. But at some point, things turned where basically when I got home, I would just sleep. And I would sleep through the weekend.
Okay.
And my mother would have to bring me food to force me to eat because I didn't have the energy.
Yeah. The vagus nerve goes from the brain stem, runs in front of the neck. So if we see here, this is C1, that's C1, this is C2, this is the vagus nerves. To live, for a human being to live, you have to have your vagus nerves, because if you don't have your vagus nerves and the body just has adrenaline, just has the part of the nervous system that gives you stress, that's called the sympathetic nervous system. If the body just has the sympathetic nervous system, the body functions as if somebody has a knife and they're about ready to jab it into your body. So just think about that. If you feel like your life's going to be threatened and that's all your body experiences is the massive amount of stress, like I'm going to die, what's going to happen to your body? At that moment, your heart rate's going to be really high. You're going to be really, really anxious. Your digestive tract isn't going to work. Your pupils are going to be dilated. Your voice is going to crack. So that's what it's like for people like Stefanie when their vagus nerves can't calm the body down. So the part of the nervous system called the parasympathetic nervous system, which is through the vagus nerves, that's what gives the body health. That's what gives the body relaxation. That's what controls inflammation. That's what helps dilate the blood vessels so there's more blood flow. That's what gives the body joy. It's also called the love nerve, right? When you sense love, you sense safety, you sense security. That's all through the vagus nerve. When your vagus nerves aren't functioning, you feel stressed, you feel anxious. Now, there's basically 3 ways that the upper cervical part of the neck gets loose, so it causes vagus nerve injuries. One is by a whiplash injury. One is what you guys are doing a lot, which is you're bending your head down with the cell phone. So if you have kids and those kids are looking at their tablets and they're looking at cell phones, just know that they're basically going to end up with a vagus nerve, the vagus nerves that are degenerated. And about 10% of the clients I see have been worsened significantly. Their symptoms have been worsened significantly by a chiropractor or somebody who did a forceful rotational manipulation. We did a 3-dimensional video on that, so you might want to go to YouTube and just put in Dr. Hauser over manipulation syndrome. So the vagus nerve goes from the brainstem, innervates the lungs, the heart, the liver, the stomach, the esophagus, the intestines. The vagus nerve is the sensor in your body to see what's going on with the immune system, how is the inflammation going on in the body, how's the nutrient level, how's the circulation, what's the hormone status, how your liver is functioning, how the brain is sensing. So the stress sensor in the body is the vagus nerve. And when your vagus nerves are not working properly, you have low vagus tone. The nerve impulses through the vagus nerves are not getting through. Then the body feels like it's under a lot of stress. So what we're talking about here is cervical vagopathy or vagus nerve degeneration from neck problems. The most common neck problem is cervical instability. Another way I like to put it is what we're talking about here is motion-induced neuropathy, meaning that there's nerves in the body like the vagus nerve that are getting injured basically every time a person moves in a certain way because of looseness in the neck is causing excessive movement. So the vagus nerve gets hit, and eventually you end up with vagus nerve degeneration or neuron cell death. The headquarters of the vagus nerve is called the nodose ganglion. That's where the cell bodies or the genetic code for the vagus nerves are, and that's at the level of C1. So right in front of your top vertebrae, the atlas C1, sits the genetic code for the vagus nerves. So when you injure the cell body of the vagus nerve's neurons start to die. And when the vagus nerve neurons start to die, then obviously vagal tone or vagus nerve functioning goes down, and thus all the things that the vagus nerve is supposed to do don't happen. One of the things the vagus nerve does is it inhibits the sympathetic nervous system. So that's a really important point. If you feel like you have too much adrenaline or you live in a stressful state all the time, the vagus nerve is not inhibiting or calming the sympathetic system down. The sympathetic system basically controls the tone of the blood vessels. So if the sympathetic system causes vasoconstriction, so if you don't have the inhibitory effect of the vagus nerve, your blood vessels can go into spasm and you can get vasoconstriction or the blood vessel gets narrowed. When the blood vessel gets narrowed, you're going to have decreased circulation to the organs like the stomach, the liver, and also in your extremities, you can get the vasoconstriction in the extremities, so you get Raynaud's phenomenon, or you might get cold hands or cold feet. So that's a sign, if you have cold hands and cold feet, that you have low vagal tone, and most likely your vagus nerves are not functioning good. This is a good example of how the sympathetic nerves, they line the blood vessels, and it's the nodose ganglion, the vagus nerve, that inhibits this superior cervical sympathetic ganglion. The superior cervical sympathetic ganglion affects the blood vessels going into the brain. So if you feel like, geez, it doesn't seem like I'm getting enough circulation to my brain, well, it's probably that the vagus nerve is not inhibiting this ganglion, and thus you have decreased blood flow into the brain. Now, the vagus nerve's influence goes throughout the face, has to do with the eyes, salivation. So the patient today that I told you that came here that has a life-threatening condition, one of her symptoms was she said, I'm not producing saliva, right? So if you're not producing saliva, guess what the nerve impulse is to the glands that produce saliva? It's the vagus nerve. So if you're not producing saliva, the reason is that you have vagopathy or vagus nerve problems, and the cause of that most likely is you have upper cervical instability. So other clues that you have a vagus nerve problem are a deviated uvula. So everybody should look in a mirror and go, ah. So if your uvula deviates, like on this person, the uvula is deviated to the right. So that would mean the muscles that elevate the palate on the left are not working. So this person has a left vagopathy, a vagus nerve degeneration on the left side. If you have pain, like in your ear canals, if you have pain in your ear canals, the vagus nerve innervate sensation in your ear canals. If your stomach isn't working, your intestines aren't working, that's a sign that you have low vagal tone or vagus nerve degeneration. As I do this 2 or 3 hour webinar, you're going to see that my voice starts to crack or my voice quality changes. That would be that my vagus nerve input to my vocal cords is struggling, because very rarely do we talk for 2 or 3 hours straight. So if you're a person who's noticed that you can't sing anymore, or the power of your voice has gone down, or your voice quality has changed, like you're a gal and you start sounding like a guy, you most likely have a problem with your vagus nerves. Vagus nerves cause swallowing difficulties, and of course that could cause a person to have a weight loss. The vagus nerve is also involved in the proper opening and closing of basically all the sphincters of the body. So you have a sphincter that opens or closes between the esophagus and the stomach. And if that isn't working right, you get gastroesophageal reflux. If your sphincter of your pancreas isn't working, you can get pancreatitis or pancreas problems. When you lay down and this improves your symptoms, that could be a sign that you have vagus nerve issues, because when you lay down, you take tension off of the neck, and then the vertebrae aren't compressing the vagus nerve. If you have a medical condition that the doctors don't know what's causing it, then I would recommend that you come to us and we would do an evaluation to see if you have upper cervical instability. And the way we do that is by a digital motion X-ray. So the digital motion X-ray is a movie camera picture of the movement of the bones while a person changes the motion of their neck. When you get a typical MRI, right? When you get an MRI and the doctors say it doesn't show anything, well, an MRI is when you're laying down. Well, all these symptoms that people have, they occur when they're moving their neck or they're upright. So the scanning methods that we're talking about that we do at Caring Medical, like digital motion X-ray, like an X-ray picture when you're moving, that's with motion. We do blood flow studies called transcranial Doppler, and we do those, like we check the blood flow, for instance, of your vertebral artery, but we would do it while you're moving. And also when we check heart rate variability, and there's different monitors we use to check your vagal tone, we see what happens to your vagal tone when your neck's moving. So that's one of the reasons why traditional medical tests, they miss cervical vagopathy. So when you have vagus nerve degeneration from the neck, you're going to get decreased stimulus to your endocrine glands. Then you end up with low hormones. You could have low adrenal hormones, low thyroid hormones. Your pineal gland doesn't make melatonin. Then you have sleeplessness. When the vagus nerve input to your spleen is not there, you get immune dysregulation. Immune dysregulation can cause a person to have chronic yeast infections, Lyme disease, leaky gut, autoimmune diseases. When you have decreased stimulus to internal organs, your stomach, you can't digest your food, so you end up losing weight, like what happened to Stefanie. You end up with vasospasms to various blood vessels, to the lungs, to the kidneys. People who have kidney disease and they don't know the cause, most likely you have low vagal tone causing vasospasm to the artery of the kidneys. You can get brainstem degeneration, which can lead to various things such as anxiety, psychological disorders, imbalance, dystonias, and a lot of different neurologic conditions. This is a more detailed figure. We're not going to, I just put that in there just so you could see, if for those of you who want to look into great detail, for instance, like let's say you feel like you have too much pressure in your head, and what could all those things cause? Well, if the blood flow to the brain is decreased and the blood flow out is decreased, you can get what's called intracranial hypertension, where you feel like there's a vice on your head and the fluid flow gets blocked in the head, and that of course can damage all the different structures in the head. Now, when you get ligament damage in the neck, now most of us, right, we are looking down at our cell phones, right? We're looking down at our cell phones. That is going to stretch the ligaments in the neck. Eventually, the curve of the neck changes, and that change in the curve of the neck stretches the blood vessels, so it's going to stretch the arteries, the veins, and the vagus nerve. And that excessive stretch on the vagus nerve, on key nerve structures, is going to cause the function in those nerve structures to go down. Now, one of the things to get better then that has to happen is you have to correct the curve. So there's different ways to correct the curve. When you correct the curve, and we just call that curve correction. If you go on our website, it'll explain the different ways to do that. When you correct your curve, the tension on the vagus nerve goes down, and with that will be increased blood flow to the brain stem, and the person's health starts to get better. So when you have upper cervical instability, that can obstruct cerebral spinal fluid flow. That causes increased intracranial pressure, which can cause diffuse brain injury and specific brain injuries that can lead to Parkinson's, frontal lobe disorders, seizures, dystonia, depression, dementia. When you get obstruction of cerebral spinal fluid flow, that can cause vision changes. So you can get double vision, blurry vision, loss of vision. And I like to call things, for instance, like people know that something's not right and they might have this anxiety that they just can't put a handle on it. And I call that structural anxiety, right? Not all anxiety is because of something that happened to a person, like a bad interpersonal relationship. Like you can actually have structural anxiety. You have a neck problem, the curve of the neck changes, you have instability in the neck, and then that hits the vagus nerve or injures the vagus nerve, and the vagus nerve is involved in calming the body down, and then if the body can't calm down, you're going to end up with anxiety. Okay, so let's think about the brain as a toilet, right? Now, I don't know about you, but we have cats, and it's amazing how the cats drink the toilet water, right? We all have seen pictures of cats going into the toilet water. So the cats know that the water going into the toilet is clean, but if you looked at the pipes after you do your business, right? If the cats were exposed to that water, they're not going to drink it, right? Because it's dirty water. So the water going into the toilet's clean. So in other words, the brain is nourished by blood flow into the brain. Then that blood flow goes throughout the brain. The brain cells and the brain cells or nerve cells are called neurons. Those neurons then function. They have metabolic activity. And the metabolic activity causes waste products to be made, and those waste products are basically then the dirty toilet water, and that has to go out the veins, right? So what happens if this can't drain properly? So you could think of cerebral spinal fluid, and that's the fluid that surrounds the brain. What if the brain toilet got clogged? Like, what would it look like, right? So this is a brain neuron. So imagine if your brain couldn't drain, right? What would happen? Well, the metabolic waste products would then accumulate and neuron cells would die. So because of our face down lifestyle, and realize all that visual input by cell phones and the internet, all that visual input, and you guys know you spend 4, 5, 10 hours a day in front of the computer. All that visual input causes an excessive amount of neurologic activity in your brain. So there's this massive dumping, if you will, this massive dumping of waste products in your brain. So your veins, the waste products go into the cerebral spinal fluid, and the cerebral spinal fluid has to drain. Well, what if, because your neck, the configuration of your neck has changed, then what if the brain couldn't drain? Well, what's going to happen is the pressure inside your brain, intracranial hypertension, is going to go up, and eventually you're going to get swelling of your optic nerves, and you'll get brain neuron death. So this is basically showing that. And when the cerebral spinal fluid flow gets blocked, like it's shown here, the frontal lobe, this is the frontal lobe, basically the fluid starts compressing parts of the brain, and you get atrophy of the brain. Now, the atrophy of the brain from an obstructed brain toilet, which almost always occurs at the C1 level, characteristically causes damage to the parts of the brain that have to do with intellect, have to do with problem solving, focusing, concentration, higher cognitive function. And those parts of the brain are the frontal lobe or the prefrontal cortex and the anterior cingulate cortex, for those of you who want to research it. And that's why when you have upper cervical instability and your vagus nerves aren't functioning right, you just kind of feel, sometimes you feel dumb. Or like I had a patient recently tell me that I'm dumb when I'm upright, but when I lay down, I feel smarter. Now, this is interesting. Now, the cerebral spinal fluid ultimately goes into the veins and it's processed by the body. So all those toxic metabolites from all the brain activity, because of all the visual stimuli we all get because of the computer, the internet, it has to go into veins. Well, isn't this interesting? The veins are the smallest at the C1 level, right? Again, it's C1. And then this is MR venography. This is what an MRI looks like when you inject dye and you do an MRI. This is where you inject dye into the veins, and this is a CT scan. And this is a case showing compression of the veins at the C1 level. This is what the internal jugular vein looks like at the C1 level, and this is the internal carotid artery. So right by C1 is the vagus nerve, the veins, the arteries that have to do with blood flow into the brain and fluid flow out. Now, when the radius of a blood vessel shrinks a little bit, the resistance in the blood vessel goes up massively. So I'm going to illustrate this by a balloon. Now, this is the neck. This is the neck with a good cervical curve. This is a neck where the cervical curve is straight. So you could see how the diameter of just this balloon by the neck being in a more straight alignment, how much it's decreased by. And this is the same thing illustrated here. The balloon diameter went from 6 millimeters to 3 millimeters. So when the blood vessel or the vein decreases by 50%, it's actually the resistance of blood flow is 2 to the 4th power. So in other words, the resistance of flow is monumentally less. Now this is with high resolution ultrasound, so this is with this probe. So the staff members here at Caring Medical were just looking at what the veins look like. And you could see when the person is laying down, the blood vessels are open, but when the person is upright, they're closed. So this closure of blood vessels, the veins, can lead to obstruction of the flow out of the brain. When the cerebral spinal fluid flow can't get out of the brain, the pressure increases, and eventually you get brain fog. Then it becomes impossible to work. Then you get loss of mental capacity, and of course with that becomes hopelessness. And these are some of the brain mapping studies that some of our patients has, but this explains it further. When blood flow goes into the brain, it's to give nutrients and oxygen. The brain neurons poop. There's metabolic waste products. And eventually the waste products are to go into the G lymphatic system of the brain. And interestingly, that system flushes during sleep. So thus, if you don't sleep, your brain actually isn't flushing the waste products. And the net result's going to be what? You can't think clearly, you have brain fog, you get irritable, and it's not good for your body. Okay, so can we play this? This is what it actually looks like, the brain getting flushed, and this was research. Look at that. That's what happens during sleep. The cerebral spinal fluid flow, it increases drastically. So that's why even before this webinar, I took like a quick power nap for like 5 minutes, and I felt like energized. So sleep causes a flushing of the cerebral spinal fluid flow, and that's one of the main effects of sleep, is to clear the waste products that are accumulating in your brain. And for that to occur, you have got to have the veins which drain the brain open. And if you have cervical instability, or you have what I call cervical dystructure, where your curve has changed in a bad way, the veins are going to collapse. Now, if you go on the internet for this, this is called chronic cerebral spinal venous insufficiency. I call it the brain toilet's obstructed, but I'm kind of a commoner. But you don't want to get a balloon up there to open up the veins or to put a stent in there, because the stent would be right next to the vagus nerve, and you don't want to have a hard thing right next to the vagus nerve. And this is the cerebral spinal fluid flow, and you could see right here, this is just an illustration showing how instability of C1, C2 could obstruct cerebral spinal fluid flow. Now there's MRIs, you can get MRIs which can show that cerebral spinal fluid flow is slowed or blocked. So there are CINE or CINE type brain MRIs that we can actually show this. And what we're trying to do by a person getting prolotherapy to the upper cervical spine, we're trying to prevent these massive cervical fusions. Now, when the cervical spine curve is optimized and the upper cervical spine stabilized, then vagal tone increases, and then cerebral spinal fluid flow increases, and ultimately the brain obstruction is resolved. And you'll hear from Stefanie shortly, and you'll see that it can occur very quickly. I just wanted to show this. One of the reasons why we don't like people to get artificial parts put in them, these are disc replacements. You got to remember, when you get a joint replacement or a disc replacement, those structures are up to 500 times stronger than ligament tissue or tendon tissue. So it means that when you have these titanium implants put in you, and you go about your daily life, the force on your knee with a knee replacement or on your neck with a disc replacement, it's going to go to those soft tissue structures, and the articular cartilage, the ligaments, they're going to start to break down because you no longer have pliable disc tissue there or pliable joint tissue. Now, sometimes when we treat people for ligament injuries, we end up bracing them for a period of time, because to get a ligament tight, to resolve joint instability, you need to stimulate the ligament to heal, and the way to do that is with prolotherapy. And while the ligament is tightening, you need to not have the ligament under excessive stress. So that's why initially, when a person has severe upper cervical or cervical instability, they might be put in a collar for a short period of time while the ligament's getting tighter. So my last patient, before I did this webinar, on her fourth visit, she got a repeat digital motion x-ray, because that's normally what we do. We treat a person 3 times, then we do a repeat digital motion x-ray to see if the ligaments are tightening and the person's instability is resolving. Her upper cervical and lower cervical instability was anywhere from 50 to 75% better. So I freed her now to start using the cervical collar less, and I'm hopeful she'll just need one more visit of prolotherapy. So when a person has increased intracranial hypertension and they get a blockage of cerebral spinal fluid flow, it's called hydrocephalus. So this is a child that I saw in 1993 when I went with Marion on a mission trip to do prolotherapy in Honduras. So for those who don't know, I've been doing prolotherapy since 1992, really. So almost 30 years. And in a child, because their cranium is pliable, the increased intracranial pressure can cause the head to expand, but you and I don't have that luxury. So what happens is, when we have hydrocephalus or increased intracranial pressure, the pressure starts to damage your brain tissue. It actually starts to cause death of brain cells. Now, how can we find out if a person has this in the office? Well, this is one of the kitty cats that's by the office. See how on this eye, the right eye, it's a normal cat eye, and this eye is dilated. So we've tried to talk this kitty cat, which we call Prolina, into getting prolotherapy, but every time we go by her, she runs away. So we're not being very, what's the word when you try to convince somebody of something? What? Persuasive. Yeah, we're not being persuasive. So the vagus nerve has a lot of different negative effects. Vagus nerve degeneration has negative effects on the eye. You get diminished blood flow to the eye. Then the pupils will open and dilate. So in other words, with light, your pupils are supposed to constrict, but you could see this cat, right? So it has some kind of vagus nerve issue probably on the left side here. So a person who has sensitivity to light, they're going to have a vagus nerve issue. If you can't focus, like your vision is off when you're reading, most likely you have vagus nerve degeneration. And also you can get increased intraocular pressure. So I'm going to show you in the office, this is Brad, who's actually here listening to this. I don't know if he's paying attention or not, but he's here. On this eye, the optic nerve sheath diameter is 4.7 millimeters. On this other side, during this scan, it was 6.4. When you have an optic nerve sheath diameter greater than 5 millimeters, that's suggestive of increased intraocular pressure, and you have a swollen optic nerve. So if your nerve, your eye nerve that allows you to see, you can understand if it's swollen, then most likely you're going to have visual issues. So this is one of the ways that we monitor a person, whether their pressure inside their head is going down, is that their optic nerve sheath diameters are decreasing. This is Rebecca, who works here, and then hopefully she's paying attention too. So we do a pupillary light reflex testing, and in this particular patient, the left eye was more dilated. So if the left eye is more dilated, then the left vagus nerve in that particular person is degenerated and not affecting the cervical sympathetic system. And the cause of that then would be what? It would be instability on the left side of the C1, C2, because the vagus nerve genetic code sits right at C1 in the nodose ganglion. So if they have instability of the left C1, C2, and turns their head to the right, say, it's going to bang on the vagus nerve. So once the cervical instability is resolved and the pressure is off of the vagus nerve, the body has tremendous regenerative capability. So that's an important point. So just know, if you stop the reason for the vagus nerve degeneration, which again is either somebody body is just sensing stress, thus you have to control your stress reaction, or if it's from cervical instability or bad posture, too much cell phone use, and you correct that and you correct the cervical curve, the tension on the vagus nerve goes away and the vagus nerve function returns, then the sensitivity to light goes away, as well as the other vagus nerve symptoms. We're not going to cover in this talk like when you turn your head and the vertebral artery blood flows obstructive, but just know that's a really, really serious problem, because then it means that parts of the brain or brainstem are not getting proper blood flow. And that's when people suffer from drop attacks or sudden severe dizziness. So if that was covered in other vagus nerve talks that I did. This is what we're talking about, is cervical instability causing autonomic nervous system problems. And when the cervical instability blocks cerebral spinal fluid flow, you're going to get damage to the different parts of the brain. When you get damage to the cerebellum, you get balance, concentration problems. You can get cranial nerve problems, your frontal lobe, right? You have obsessive compulsive disorder, memory problems, your intelligence seems to go down. So please, if you have brain fog or you feel pressure in your head, it's important to get a digital motion x-ray to look at if you have cervical instability, and if you do, you need to get prolotherapy to resolve it. Now, remember we said with Stefanie, her main problem was her stomach wasn't functioning. She had constant nausea. If you have constant nausea or you can only have a little bit of food and it's awful and you go to a gastroenterologist and nobody can figure out what's wrong, you probably have cervical vagopathy. And the cervical vagopathy is causing compression of the nodose ganglion, causing vagus nerve degeneration, leading to what? Reflux, gastroparesis, irritable bowel syndrome, increased intestinal permeability. If you've been told you have leaky gut and you have to be on these 5 foods and you can't eat other foods, if you follow the neurology of that, you want to be able to eat other foods, well, you got to get at the cause of the leaky gut, and the cause of it almost always is decreased vagus nerve impulses to the enteric nervous system. So to resolve that, you need to resolve your cervical instability. So anybody with pyloric stenosis, small intestinal bowel overgrowth, autoimmune diseases, who has neck pain, especially clicking, grinding, popping of the neck, you have cervical instability until proven otherwise. And if you resolve this, you're probably going to resolve your overall inflammation in your body, and you probably are going to get help for your autoimmune disease, your food allergies, your pyloric stenosis, your gastroparesis, your irritable bowel, your Crohn's disease, your ulcerative colitis. Right? Here's the vagus nerve. The nodose ganglion sits right at C1, which we said. The vagus nerve is essential for digestion. So if you have any kind of digestive problems, then the vagus nerve innervates all the digestive organs, all of them. And the neurology of all digestive disorders leads to the vagus nerve. And cervical instability can cause almost all digestive maladies. Because isn't it true, if you go to a doctor and they say that the scan showed you have ulcerative colitis, like you got inflammation of your rectum, or Crohn's disease, you have inflammation of your small intestine, you have pyloric stenosis, you have diarrhea that nobody knows why, or you have constipation, nobody knows why, you have gastroesophageal reflux, nobody knows why. You know what I mean? There's, the curative treatment isn't to take a medication, right? To take a strong anti-inflammatory or a acid blocker, right? That's the treatment. But the question is, what caused it? So the cause of almost all these things from a neurologic cause or a structural cause is cervical vagopathy. Cervical problems, which I call cervical instability, causing the destruction of the cervical curve, causing stretching injury, compression injury of the vagus nerve. Then the vagus nerves don't cause the proper functioning of the pancreas, of the pyloric valve, of the gastroesophageal sphincter, of the intestines, right? And that's what's causing all these disorders. So the stomach's innervated, the small intestine's innervated by the vagus nerve. If you have a chronic cough, you got laryngitis, nobody knows why. You always feel full. You vomit undigested food. You have a lack of appetite. You have a vagus nerve problem until proven otherwise. You need the vagus nerve for your stomach to contract to cause the food to get broken down. So when you swallow food, your pharynx, your esophagus, your stomach, your small intestine, your large intestine, it has to contract. Well, guess what? If your vagus nerves aren't working, there ain't no contractions happening, or there's abnormal contractions, right? You could all of a sudden, you feel unbelievable pain. Why do you feel unbelievable pain? Well, the contractions aren't normal, or the valve isn't opening, right? If you, like people say, oh, the food gets stuck, right? Or the stomach, it gets all bloated. So Stefanie, when she said that instead of her stomach emptying in an hour or two, the stuff just sits there for 8 hours, right? So the cause of that is the vagus nerve input to the stomach isn't correct, right? Then you get pyloric stenosis, you get nausea or bloating. So so gastroparesis just means that there's delayed gastric emptying when you eat. So the cause of that is vagus nerve degeneration. The stomach musculature isn't working. Once your vagus nerve functions normally, the stomach acid is secreted. The stomach churns the food, digests the food. The pyloric valve opens, and the stomach functions normally. So I just want to go over that again. For the stomach to function normally, you need the vagus nerve input to it. When you chew food, the food has to get into the stomach. So the gastroesophageal sphincter has to open. Then when there's food in there, stomach acid has to be secreted. That again is a vagus nerve function. Then the stomach has to contract to churn the food, digest the food. Then the pyloric valve has to open once this is digested, and then it goes into the duodenum. So all that is dependent on the vagus nerve. The vagus nerve can be the cause of all these GI motility disorder. So if you've been diagnosed with gastroparesis, enterocolitis, dyssynergic defecation, cryopharyngeal dysfunction, dysphagia, unknown etiology of digestive disorder, pediatric achalasia, all these things, inflammatory bowel disease, most likely you have a vagus nerve problem. And that vagus nerve problem can be from the neck. And don't discard for kids. These kids got all kinds of cramping, right? They got colic, they got all kinds of digestive things. A lot of times this is from the vagus nerve not working right. And in kids, in really young kids, you might want to have them see an upper cervical chiropractor, right? Because kids, you only need a little bit of force to change the configuration of C1, C2. And if that doesn't work, then of course you seek out the care of a experienced prolotherapist. The vagus nerve also innervates the pancreas. So if you're somebody who has exocrine pancreas insufficiency called EPI, Mary and I have a kitty cat that has EPI, and she needs enzymes to digest her food. If you're somebody who needs enzymes to digest your food, or you have a pancreas disorder that nobody can figure out what the cause of it, it's most likely from vagus nerve degeneration, vagopathy, because the vagus nerve is needed for the pancreas to make enzymes. You have gallbladder disease, right? Here, I'll talk.
You go ahead.
Okay, so gallbladder disease, if you have gallstones or you have sluggish gallbladder functioning, most likely that also is from vagus nerve neuropathy or vagopathy, because the sphincter that opens to let the contents of the gallbladder, the bile, to digest fat, that's under the control of the vagus nerve. Okay, now we're going to see how Stefanie's doing after 3 prolotherapy visits. I'm just going to say that you're going to see some pictures there because Stefanie has many body parts treated. Like she might have 10 to 15 body parts because she has Ehlers-Danlos syndrome. So she has a neck problem along with other joint instabilities. So she actually gets her treatment under conscious sedation. So there's a nurse anesthetist, and we use bone marrow for her as the proliferant. So let's hear what she has to say.
Now, you've been only in Florida about 5 weeks, so
how has your symptoms changed in the 5 weeks? Now you've had 3 prolotherapy sessions.
Honestly, drastically, I would say after the first treatment, 4 days in, I was actually on a mental side able to comprehend and handle things emotionally way much better. I would explain that if something emotional would happen in my life or if something stressful would happen, it would just be a very immediate and now I can compartmentalize things way much better because that is my normal personality. But after the first and second and third treatment, I realized that how much that had degraded over a period of time.
So you feel like your brain function is basically getting back to normal.
Yeah, I just don't feel like I have a brain fog or that I'm underwater.
And then also the staff had noticed too that like your color was better and almost like you were more peaceful. Like the stress, like when you first came, like don't you think probably smiling more?
Yeah, no, I do agree with that. I mean, I do have anxiety. I admit that I've had anxiety for a while, but when these symptoms started getting worse and worse and worse, it was crippling.
What about your pain? Like, describe your headaches or your other pains that you've had.
It can be piercing and it's constant. But with these treatments, it's definitely been a huge relief to me personally. Because if you just, honestly, I would wake up and just move, and all of a sudden I would hear a crack or a pop, and I just realized I had dislocated something, my hip, and used to the pain so much.
Just after the 3 treatments, how much of your pain do you feel is relieved?
Way much better than any pain medication could do, honestly.
Yeah.
The pain medication that I was on, and, going through this treatment still, but I have complete hope that I'll be able to be off of it, because with just pain medication, I would only be able to get... My comparison would be out of 1 to a 10, it would probably be an 8, because my 9 and 10s are when I'm in the hospital, and it would bring me down to maybe a 6, and that was just tolerable enough to maybe walk around for 10 minutes a day, and then lay down for the rest of the day.
And how about now?
I can walk around. Me and my mom, we actually walked around for like half a mile.
Awesome. That must have felt good.
That actually felt really good. And no popping either. No hip popping, because when I was in the hospital the last time, they pretty much told me for my right hip that it's not a question of if you'll need a hip replacement, it's a question of when you'll need it. And they were pretty sure that I was going to need it soon. And being a 27-year-old, that's not exactly something you want to hear.
What pain level did you have when you walked around that half a mile? Like, you still had probably some pain.
Oh, yeah,
but was it down to like a 3 or something?
I would probably say it was about a 4.
Okay. That's good.
It was about a 4.
That's good. So you can walk. You had a lot of your body, a lot of your joints done, and now it's 2 days later, even though you had hundreds of shots, and you're functioning pretty good today, right?
Yeah, no, the bone marrow is it's a lifesaver. I would explain, and I think you kind of explained this in a good way. It re-jolted my nervous system. It's like an energy boost almost. It made everything just work better. You wake up and I'm walking around the next day, and I'm just like, immediately I could feel a difference, and that's how I would say bone marrow works for me versus other treatments.
Do you feel like your vagus nerves are getting back to normal?
I would definitely say that they're going to a more normal rate, yes. Just with the monitoring system you gave me, the HRV thing, just understanding like how much I'm talking, because I literally kind of just went into a shell pretty much. I didn't talk a lot. I didn't really do much.
You had like no energy for it. And now you're like, today you just seem like you got a lot of energy.
Oh yeah, no, I actually put makeup on for the first time in like 5 months.
Is there anything else you'd like to say to anybody who's watching this video?
You yourself know your body the best. If there's a doctor out there that tells you, I understand you're experiencing these symptoms and everything like that, there's a reason you're experiencing these things. There's a reason things are going on, and just because the doctor tells you there's nothing wrong doesn't mean there isn't anything wrong.
Here, Stefanie, the main thing that she said really at the end was, if a doctor says that nothing's wrong, don't just take that at face value, like there is something wrong. It just means that the tests they did, it didn't find what was wrong. And really that's kind of her message. And my message over the course of these 6 hours of doing the vagus nerve problems is, if you have a condition where the doctors don't know what's causing it, if you follow the neurology, the nerve with it, whether it's arrhythmia, low hormones, leaky gut, you've had Lyme's disease and you still have all these symptoms and nothing's helping, or you have autoimmune disease, you have chronic fatigue, you have brain fog, you have new onset anxiety, you have ringing in your ears, your balance is off, you get lightheaded for no reason, you can't concentrate, you have blurry vision. If you follow the neurology, you're going to see that it ends up with that you have a vagus nerve problem, and the cause of the vagus nerve problem is going to end up being your neck, because we're all hunched over. We're all hunched over with a cell phone. So when you're hunched over, right, the vertebrae separate and you get ligament laxity, and the weak link in the musculoskeletal system are the ligaments. Now, one of the ways that we monitor, and you guys could do this at home, so if you want to see how your vagus nerve is functioning, get a heart rate variability monitor. So there's lots of different companies on the internet. The one that I have personally is Elite HRV, but you don't have to use that one, but I don't get paid to say that. So you can monitor your heart rate variability. Now, what heart rate variability is the variability between heartbeats. Like if your pulse rate is 60 and the beats are every second, there's no variability. But on an EKG, one beat to another beat might be 0.8 seconds. Then the next beat might be 1.2 seconds after that. So the variability between those two beats is 0.4 seconds. And then it turns out that the vagal tone, when you have high vagal tone, your heart rate variability is increased. And the parameter on the heart rate variability that's increased specifically is the high frequency band, And it turns out that so in other words, when you want to monitor whether your neurology is vagus nerve dominant or sympathetic or adrenaline dominant, if you want to do that, the way you do it is by heart rate variability. So right now we're measuring my heart rate variability. Like we have it. So in other words, we downloaded the app. Now I have the monitor on it, and you see that my variability is like 80 something. So anything over 70 is good. So even though I'm doing this talk and I'm actually a little bit tired, my variability, is over 80. And many of my patients, honestly, their heart rate variability is in the 30s, 40s. It's very, very low. So when you're stressed out and it's boom, 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 your heart rate, there's very little variability. When you're relaxed, right, you take deep breath in, deep breath out, like you're a very deep, slow breather, and your vagal tone is very high, you have a large variability between beats. When you take a deep breath in, when you take a breath in, the heart rate speeds up a little bit, so more oxygen goes into the bloodstream. And then when you breathe out, the heart rate slows down, so more blood gets going to the body. When the low frequency band of the HRV is dominant over the high frequency, which is the parasympathetic, your sympathetic dominant physiology. It means that your neurology, moment to moment to moment to moment, is sympathetic dominant. Then your risk of death increases greatly. So in these turbulent times, in these times of various infections going on in the world, we need to have high vagal tone, right? So this is just an illustration of the different variability between beats. So heart rate variability, the higher your heart rate variability, the greater your vagal tone. Okay, and then I'm going to show you how we monitor vagal tone in our office. And you'll see that what we do is we're monitoring. You could see Stefanie's vagal tone, right? See, mine was in the 80s, hers is in the 30s, and her heart rate is very high, at least the day where she came in, right? So when your vagus tone is high, your heart rate is low, and your heart rate variability is high. See how we're moving her neck? So we do dynamic heart rate variability testing where we measure various parameters of heart rate variability with neck motion, and then we can tell what motions increase or decrease heart rate variability. Okay, so this was Stefanie's scan. So you can see that her scan, when she was at rest, right, she's laying down, her vagal tone is really high. When she did a math test, her vagal tone was terrible. And okay, so this is the high frequency, the high frequency power. Then this is a patient who had upper cervical instability. You could see that with how her sympathetic tone was much greater when she did rotation of her neck than when she did extension. So what we do with this test is we can tell a person's vagal tone, how it changes with a stressful memory, with loud noises, with various rotations, with extension, or with rest. So we would expect then when you have upper cervical instability, when you rotate your head, right? When you rotate your head, that's going to jam on the vagus nerve. And when you jam on the vagus nerve or you injure the vagus nerve, then the vagal tone's going to go down and the person's going to have sympathetic dominance. So Stefanie's vagal tone was better when she was extended. When she did rotation, it went way down. When she did a stressful memory, her vagal tone went way down. So don't downplay how your thoughts affect vagal tone. So look at this. So just a stressful memory, you could see how it changed. Then this is another patient. Look at this. When we looked at her balance between the low frequency, which is her sympathetic tone, and her high frequency, which is her vagal tone, when she laughed, it was balanced, right? It was balanced. When she did a math test, it was terrible, meaning that, the parts of the brain that have to do with problem solving and math equations, they're getting injured. When we did a loud noise, her sympathetic tone went way up. And then immediately when we asked her to think about a stressful memory, her sympathetic tone went 19 times greater than when she was laughing. Like, think of that. So this person had been in counseling, and I told her, you could say that the counseling's helping, but, and according to my scan, the minute you think about that thing, you have incredible stress in your body, right? So I'm trying to help her get her vagal tone better by doing prolotherapy and everything. But if somebody doesn't resolve this, and we talked about, in my opinion, what she needed to resolve this, means every time she had that memory, then her sympathetic tone went way up and her vagal tone went way down. So laughter, this is a good example of how laughing improves vagal tone. Other things that improve vagal tone is having pets, being outside, touching other human beings, laughing, being around friends, experiencing love, aromatherapy, yoga, prayer, having an increased faith in God. So those are all things that we all need to be doing to improve our vagal tone. Now, one of the people asked about the kidneys. Now, the kidneys. So what happens is, see how it says kidney disease here? When you have upper cervical instability and it causes compression of the nodose ganglion of the vagus nerve, you can get vasospasm of arteries. And there's lots of people that I see, or I've seen over the course of the last 30 years, that have high blood pressure and they can't find the cause. Well, this could be one of the causes. So vasospasm ultimately can cause heart disease, kidney disease, lung disease. If a person has kidney disease and nobody knows the cause, and the person has other symptoms suggestive of neck problems, and that would be neck tension, headaches, clicking, grinding, popping sensation, other symptoms such as dizziness, tinnitus, then I can't emphasize enough, you have got to get a digital motion x-ray to look at cervical instability. And again, I do Skype visits. If you live far from Fort Myers, Florida, just do a Skype visit and we can talk about whether or not you should get an evaluation for cervical instability. Now, this just kind of shows you that if the vagus nerve doesn't inhibit the superior cervical sympathetic ganglion, you're going to get vasospasm of various arteries. And the vagus nerve inhibits the sympathetic chain, which assures good blood flow to the brain, to the heart, to the internal organs. So if you don't have proper vagus nerve tone, you're at risk of getting decreased blood flow to the heart, to the lungs, to the intestines, to the hypothalamus, to the cranial nerves, and the hypothalamus and pituitary and adrenal gland. When those things don't work right, you're going to have a heightened reaction to stress, and your body's going to have high cortisol and going to have a hard time resolving systemic inflammation and systemic sympathetic dominance. Now, this is what it looks like under a microscope when you have destruction of your vagus nerve. So when you have destruction of nodose ganglion, this is kind of what it looks like. And when that happens, at least in animal studies, right away the animals start getting vasospasm in all kinds of arteries, and you get infarction of the heart, infarction or death of lung tissue, kidney tissue, brain tissue, right? If you've had a stroke and nobody knows the cause of it, you got to get an assessment for cervical instability, because probably that's actually the cause of it. So this is kind of just more information that shows you that when you have damage of the nodose ganglion, all these organs can get affected by diminishing blood flow, along with the other things that we've said. So when you have vagus nerve degeneration, that causes the enteric nervous system to degenerate, and ultimately you get intestinal gland atrophy, right? And that intestinal gland atrophy can cause what? Leaky gut and all kinds of digestive problems. You can even get damage to other nerves when you get vagus nerve degeneration. When you degenerate the vagus nerve branches to the kidneys, you can get spastic arteries, you get glomerular kidney cell death 17 times more, and you can ultimately get kidney failure. So this is very serious when your vagus nerves aren't working right. And ultimately, you can get organ failure. So if you have a spleen that's not working, lung, intestines, heart, brain, liver, please get an assessment for your vagus nerve function, and get an assessment to see if you have cervical instability. There's lots of people that have trigeminal neuralgia or other cranial nerve problems. They get ear pain, migraines, POTS, anxiety, Bell's palsy, hoarseness of talking. You can get torticollis. You get like where you get tension in your trapezius muscle or your sternocleidomastoid muscle. You can have dystonia. Anybody with dystonia or torticollis, cervical torticollis, should get an assessment for upper cervical instability, because probably they have compression of the nodose ganglion, ultimately causing the cranial nerve neuralgia, like trigeminal neuralgia. Look at all these symptoms: visual symptoms, double vision, paralysis of the muscles, vertigo, difficulty swallowing, all these things. That if your tongue's not working right, or your taste has changed, anything regarding the functioning of the face, and the doctors don't know what the cause of it. The cause is probably upper cervical instability causing the vagus nerve, and you need proper vagus nerve functioning for your cranial nerves to work right. Right, and this just shows the vagus nerve in relationship to the facial nerve, and the facial nerve is what's involved with Bell's palsy. So if you had Bell's palsy or you've had trigeminal neuralgia, you probably have lost the vagus nerve input to the facial nerve or the trigeminal nerve, and that's one of the causes, can be the cause of trigeminal neuralgia and facial nerve problems. Now, lots of people who have headaches, they end up getting botulinum toxin injections. And the problem with those injections is they weaken the muscles that are needed to stabilize the neck when you have cervical instability. So if you have cervical instability, you need the muscles to stabilize those joints. So please don't get botulinum toxin injections if you have cervical instability. So anybody contemplating botulinum toxin injections for headaches, you definitely got to get a scan for digital motion X-ray, in my opinion. So here, let's just see one patient that had gotten botulinum toxin injections for 2 years prior to this digital motion X-ray. Okay, so you can see that the curve's terrible, and see how it smashes right here. The occiput smashes right here on C1. Look at that. Every time they looked up, bam, 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 right? And and then when the person bends forward, there's all kinds of instability here. There's all kinds of instability. And look at how this narrows, that narrows. And this person, ultimately the botulinum toxin injections cause just a horrible worsening of their symptoms. Okay, so go to the next one. Now, those of you who have heard me before know, and I've talked about this a lot, is the ligament muscular reflex. So anytime you have a ligament injury, and remember, ligaments connect the bones. When there's a ligament injury, it means that the ligament can't control the motion of the bones. So there's a neurologic reflex that the muscle's going to tense up. So chronic muscle tension is the body's response to help limit bone movement when you have instability from ligament injury. So if you get botulinum toxin injection into muscles that are needed to limit motion, then and those muscles weaken, obviously the instability is going to worsen, and so are the symptoms. So if you know somebody who's had botulinum toxin injection and their symptoms are much, much worse, well, they probably have cervical instability, and now the muscle is so weak it can't do anything. So the instability is worsened, and so is the vagus nerve injury and all of the other things that the upper cervical instability causes. So this is an illustration of somebody having ligament injury in the neck, right? Then these muscles in this figure, it's the obliquus capitis superior and the rectus capitis, and the obliquus capitis inferior muscle. So the person got botulinum toxin injection right here. These weaken, then C2 rotates. So in other words, think about it. The C2 rotates, right? It rotates. So guess what's going to happen in the front here? The rotated C2 is going to hit the vagus nerve. So a person could have like just headaches, then they get botulinum toxin injection, and then that injection weakened the muscle, and then all of a sudden they get a lot of neurologic problems afterwards. So that's one of the causes of it, because the muscles can't tighten anymore because they've been weakened by botulinum toxin injection. So I'd really encourage anybody with headaches, because headaches have a cause, and I can tell you there's no headache in the world that's caused by a botulinum toxin deficiency, right? Botulinum toxin deficiency doesn't cause headaches. Headaches are almost always caused by upper cervical problems. And in the patient I told you, the head was smashing on the C1, which was causing C1 neuralgia, along with a lot of other things, which we have helped correct in this particular person, right? When the C2 rotates, all these things can happen. You can get fullness in the ear, tinnitus. So anybody who's had botulinum toxin injection and afterwards had any of these symptoms, tearing in the eye, choking sensation, stuffy nose, metallic taste in the mouth, swimming sensation like you're in water or you're underwater, fatigue, brain fog after a botulinum toxin injection, most likely what it caused or amplified was the cervical instability, and thus autonomic nervous system problems, specifically low vagal tone. And this is on x-ray what a malrotated C2 looks like. See, it's supposed to be in alignment here, and this particular patient is rotated. So a person can get chiropractic care for this, and there are some brilliant upper cervical chiropractors. However, if the cause of it is cervical instability, the best treatment's going to be prolotherapy. So I'm not going to go through all this because I talked about most of it, but I really encourage anybody who's had botulinum toxin injections worsen their symptoms, please read this and study it and get an assessment for cervical instability by digital motion x-ray. The upper cervical instability can cause compression of the nodose ganglion, which can also compress blood vessels, give dizziness, loss of balance. You can get brainstem problems. So the vagal nerve nuclei. Like, in other words, where the vagus nerve actually connects is in the brain stem, and then those connections go to the brain. So that's how, one of the ways how the vagus nerve affects the functioning of, say, the brain. And then here's an example. This is the brain stem, and you could see that's on this. You could see where here's the upper cervical spine, and then here's the brain stem. So the medulla and the pons is where the respiratory centers are, the blood pressure centers, the nausea center, and even the salivary center. So if you have excessive salivation or no saliva, it's probable that you have something affecting the brain stem. And you can see where all the facial nerve, the cranial nerves, they attach, they originate in the brain stem, and the vagus nerve is right there. Here's the nodose ganglion right here. The other ganglion of the vagus nerve is a jugular ganglion, and it goes into the medulla, and then from here it can affect all the other cranial nerves. Right? And then one of the things that the vagus nerve does, it slows the heart rate down and it slows the body down. So if you're somebody who your heart rate is normally 70 and now it's like 100 or 95 all the time, that's going to be because your vagus nerve is not slowing your heart rate down. So please get that assessed. And here, the vagus nerve, these are all the nuclei of the vagus nerve. You can see that the vagus nerve innervates the taste buds, the ear canal. It affects the thorax, the lungs, the pharynx. Here's the lungs. You can see where we have the vagus nerve right here. The vagus nerve innervates the lungs. So if you inhale something or you have an infection in the lungs, guess what tells the brain that there's an infection in the lungs? That's going to be the vagus nerve, right? When you cough, that's the vagus nerve. So if you have chronic hiccups, chronic coughing, you probably have a vagus nerve issue. If you have asthma, right, you have asthma. You have chronic pneumonias. You have a weakened immune system for your lungs. It's probably from you have poor vagal functioning of your lungs. This is how the cervical instability and the loss of vagal tone affects the lungs. So it can affect the muscles of the larynx, the vocal cords, so you can't get normal airflow. It can cause vasospasm of the pulmonary arteries to get low blood flow to the lungs. It can cause problems with breathing, like, right? If you're somebody who you have to think to take a deep breath, like almost like your body doesn't automatically do it, you probably have a vagus nerve problem. If you have symptoms of air hunger, you have a scared feeling, you can't get air in and out of your lungs, most likely you have a vagus nerve problem. If you have poor airflow, like you just can't, your diaphragm doesn't work so good, again, you probably have cervical instability. If you chronically have a cough, you chronically have sinusitis, you have asthma, you have allergies, and you go on a diet and it seems to not really make an effect. You're seeing a holistic provider, but your immune system is still poor. Your lung function is still poor. Well, you probably have cervical instability, screwing up the vagus nerve, screwing up your lungs. And these are just, again, I'm not going to go through all this, but just the vagus nerve goes to the things that determine the pulse rate of the heart. The vagus nerve ganglion are very, very small. And if you have excessive motion, it's going to bang on it, bang on it, bang on it to the point where your vagal neurons die. And when they die, then, of course, your vagal tone's going to go down. Your vagus nerves don't function well. And you're going to get anxiety. You're going to get gastroparesis. Now, when your vagus nerve can't have proper input to the brain. So in other words, when a person gets their vagal tone up or they get vagus nerve stimulation, certain parts of the brain are stimulated, certain parts are inhibited. So this is the vagus nerve going to the nucleus tractus solitarius. That's one of the vagal nerve nuclei. When that's stimulated, it goes to the various parts of the brain that does what? That increases your neurotransmitters in your brain so you feel happy. So if you're having trouble feeling happy, then you probably have a vagus nerve problem. If you feel stressed, you have obsessive compulsive disorder, you feel hopeless, you have depression, probably this circuit isn't working, because you're not having the proper vagus nerve input. And this is really common, right, in kids, right? We have a lot of kids that they're not behaving properly. Their problem solving abilities down. They feel, they almost look like they have brain fog all the time. And we're seeing an enormous amount of kids that have all these difficulties. Like there's kids who have seizure disorder, imbalance, difficulty speaking, blurry vision, skin and sound sensitivity, mast cell activation, dystonia. The kids have such health problems. They have terrible autoimmune diseases. They have allergies, and that people go to holistic providers, and maybe the kids got diagnosed with Lyme's disease. I'm not saying Lyme's disease doesn't exist, but the symptoms of chronic Lyme's disease, often it can be from cervical instability and upper cervical instability. So if you have a child and nobody can figure out why they have a certain symptom, or their digestive tract isn't working right, or they have a dystonia or seizure disorder, it's probable they have cervical instability, right? This is how kids are, right? These are kids. These are some of my staff members' kids. They're looking down, and then they end up getting cervical instability, right? So look at this. This was a child that came to our office. Look at the amount of instability at C1, C2 right here. It's enormous. It's severe, right? Which child has symptoms? I just put that up there because just to show that even in the kids, in the kids that don't have symptoms, their curve is being affected. So even if your kid, these two kids over here don't have symptoms, these kids have symptoms, and these kids right now don't have symptoms, this 11-year-old and the 16-year-old, but I can 100% guarantee you they're going to have symptoms because they're already getting instability. So you have got to, as the parent, you have got to get your kids to have a good cervical curve, and you have a good cervical curve by looking up. You have a bad cervical curve by looking down. I'm going to look at cell phones more. I'm going to look at iPads more. And if your kid's doing that, these kids are going to get the diseases that my generation would get like in their 70s, right? There's more and more kids that are they're hysterical, like their autism is crazy. There's right. Every other kid has ADD. Every other kid has autism. Every other kid has behavioral disorder, and a lot of it stems from all this instability in the neck causing their vagus nerves not to work, so nobody can calm that kid down, and the kid, because of cervical instability, doesn't have proper brain function. So what's needed is we have got to get the kids reading regular books, looking up, be in sports where you look up, like dancing, baseball, soccer, and we got to get kids outside and, looking up at the sky, looking up at the trees, and not be so much looking down at cell phones. I can't tell you how bad the cell phones are for the developing kids. Kids have big heads, they have little necks. Their body is prone to getting cervical instability. Like you could just see when you get cervical instability, you get this horrific curve, which I call cervical destructure. So we have kids, 8-year-olds, 7-year-olds, 10-year-olds, where their curves are totally destroyed. But I'm happy to tell you that when the kids start looking up and doing exercises where they're looking up, they can totally get their curve back. And once they get their curve back, a lot of the symptoms go away. Now, heart rate variability. So I would suggest to anybody who thinks they have a vagus nerve issue, please start monitoring your heart rate. And in long-term studies, we found that people who are outside, who train, who are athletes, their heart rate variability goes up and their health goes up, right? And when you deep breathe, so in other words, one of the practices that we all should do is be silent and work on very deep breathing, slow breathing. The average person breathes about 10 to 15 times a minute, but heart rate variability is maximal. And you could see, right, even though I've been talking for 2 hours, my heart rate, right now is 76 and my heart rate variability is in the 80s. So my heart rate variability, or my amount of calmness or vagal tone, even right now in the middle of this, is very high. And I could tell my staff who's listening here, they're struggling. No, but it just shows you, like, it really is related to vagal tone. And I'm confident if we looked at Corona, who got really sick or deathly sick, and you looked at vagal tone, you'll see that people who have high vagal tone, they survive. And if you don't have high vagal tone, you're very at risk of having significant injuries, consequences when you get an infection. So one of the things we do is we do vagus nerve stimulation, and anybody can get a vagus nerve stimulator, and the vagus nerve innervates certain parts of the ear, and that's one way to increase vagal tone. These are various, this is a vagus nerve stimulator. These are some of the protocols. Anybody can go on the internet and look at the various protocols, and you'll see that vagus nerve stimulation helps a lot of diseases. But better thing than vagus nerve stimulation, of course, is to actually correct the cause of the vagus nerve degeneration, which often is prolotherapy and curve correction to resolve the cervical instability. When vagus nerve stimulation can increase the contractility of the heart, that increase blood flow throughout the body. It can increase the contractibility of the heart. Look at this. When you stimulate the vagus nerve, look at all these things that happen to the brain. You get increased blood flow to the brain. You get growth factors are made in the brain, nerve growth factors. You can actually start neurogenesis, or the birth of new neurons. So in our office, we measure the size of the vagus nerves, and you can actually cause the vagus nerves to grow and the neurons to be regenerated. So even though I've talked about a lot of negative things, I want to leave everybody with all the stuff we've talked about is correctable in almost all the people. So even if a person has brain degeneration, right? They have atrophy of the frontal lobe, right? From damage because of the blockage of the brain toilet. You can cause neurogenesis if the vagal tone increases. If you have, like the doctors, I have patients come in and say they got chronic Lyme's and it's affected their brain, and they have inflammation of the brain or body inflammation. Well, the way the body resolves body inflammation is through the vagus nerve. So you have to increase your vagal tone to resolve brain inflammation, and then you get, you're able to think better, your mind's clearer, and of course then you have more energy. how many prolotherapy treatments does a typical person need? Well, it kind of depends on how severe their symptoms are and how severe the cervical instability is. So this is another reason why some people, the more severe your symptoms, the more it's really a good idea to do a Skype visit or a telemedicine or a consult with me over the internet. What do we call that? Is it called Skype? What's it called?
Video conference.
Video conference, yeah. I guess you know me, I'm a commoner. Izzy's like sophisticated. Okay, so video conference. No, but you know, we do a video conference, we talk, and some of the patients, the severity of the illness is so severe that I actually have to have them live in Fort Myers, Florida for a month or 2 months, because if somebody's losing weight drastically, of course, they should stay here and have me treat them more frequently. But generally, people travel here, then I treat them, and of course then they go back home, and I see them about every 4 or 5 weeks. And depending on the cervical instability and how severe the symptoms are, that will determine how many visits. Thank you for joining us today, and if you have any questions, please consult me at drhauser@caringmedical.com. Then the next webinar is going to be on Ehlers-Danlos syndrome. If you have Ehlers-Danlos syndrome and you want a specific topic to be discussed, please email me. I'll definitely cover it. And that's going to be on July 21st. And if we didn't cover something on the vagus nerve that you wanted covered, again, please email me and look at the other 4 hours of video webinar I did on the vagus nerve. I'd also encourage you to do the upper cervical webinar that again was 2 hours. Thank you everybody for your time, and just, you know, on behalf of Caring Medical, we wish you the best of health, and let us know in any way how we can service you. Have a great day.